Those planning the vaccine rollout here in Canada are closely watching the UK to see what lessons can be learned. Although the hope in the UK was to vaccinate residents in long-term care homes first, that is not happening with the Pfizer vaccine. And today, Canada's Chief Public Health Officer said it likely won't happen here either. The initial doses are likely to be given only to people who can physically get to one of the 14 vaccination sites.
The concept at the beginning of rolling out the Pfizer vaccine is to try and sort of keep it at the point of use. That's for a start. But it's true that you cannot move residents very easily from a long-term care facility to a vaccination site. So that's just the realities.
Health Canada is expected to approve the first vaccines later this week. Working out the delivery plan is like piecing together a jigsaw puzzle involving the federal government, the provinces, and the vaccine manufacturers. Mike Drolet looks at how Canada's vaccine rollout is coming together.
In a research centre not far from Ontario's legislature, in a nondescript hallway adjacent to a row of lockers, sit the most important freezers in the country.
We just need the vaccine. As soon as it arrives, we're ready to go. Gnawing at the bit right now.
How ready is debatable, since the initial delivery of doses from Pfizer need to be stored at -70 Celsius or colder. Once the vaccine begins to thaw, it's only good for a few hours, meaning Canadians will have to go to where the freezers are. And the most vulnerable Canadians are also the least mobile.
It's a rapidly evolving situation, so I think everyone has to remain flexible and adaptable.
Complicating matters is the continuing surge of COVID-19 cases, as well as more outbreaks in facilities like the 242-bed Westside long-term care home in Toronto, which has had 117 residents and 57 staff members contract the virus in the last month. Nobody is going in or out, and Dr. Dawn Bodish says it's likely the outbreak will need to pass before residents can be safely immunized. The best option right now, she says, is to immunize the staff.
The logistics of this are a nightmare. The logistics are an absolute nightmare. How do we get this vaccine to our country frozen? The fact that we don't have manufacturing on site is a problem. And then once it gets here, how do we distribute it equitably?
The first vaccine has yet to be doled out, and already the concerns are as big as the plan itself. Plans which epidemiologists hope aren't written in stone.
A good plan is better than a perfect plan, and so getting more arms and needles together and not really having much of a planning time where the vaccine is sitting in fridges is a whole lot more important now.
Mike Drolet, Global News, Toronto.
Administering the vaccines once they are delivered is up to the provinces and territories, and they're developing plans and priorities based on their populations. David Akin explains what we know about that.
38 million Canadians, but there's only enough of the first batch of vaccines from Pfizer for about 125,000 people to get their first dose by year end. So how to divvy that up? Ottawa and the provinces have agreed to share those first doses on a per capita basis. So that means about 48,000 in Ontario will get their first shot by year end, 28,000 in Quebec, 17,000 in BC, 14,500 or so in Alberta, and less than 5,000 in every other province. Because of logistics issues associated with Pfizer's vaccine, none will get their dose for now in the 3 northern territories. But the provinces have sole jurisdiction when it comes to deciding who will be first in line, and each province is making slightly different decisions. Most put residents of long-term care facilities at the top of the priority list, while Ontario and Alberta insist staff as well as residents in long-term care homes get top billing. Quebec puts long-term care staff and all healthcare workers in that province, that's about 325,000 people, as its second priority group. Ontario's number 2 group is anyone who works or studies in a hospital, and that would include everyone from food preparation people to maintenance crews to doctors and nurses. Alberta's number 2 priority group is anyone over 65 living on a First Nations reserve. Once those groups are done, each province moves to its third priority. In Alberta, that's anyone over 75 years of age. Ontario will move next to focus on adults in Indigenous communities, while Quebec will vaccinate seniors living in retirement homes or private group residences. Still, federal officials continue to insist that every Canadian who wants a vaccine will get it, though it may take until the end of next year to complete that objective. David Akin, Global News, Ottawa.